Dear students, my name is Eszter Fábián, and today we will talk about the respiratory system. We'll start the screen sharing. So, first of all, let's see the main parts of the respiratory system. We can distinguish between the upper and the lower airways. The upper airways consists of the nose, which is called the nasus in Latin, the throat, pharynx, and below this, the lower airways begin with the larynx, trachea, and the lungs, which contain the bronchi and the bronchioli. The nasal cavity is composed of an external nose, which is a partly cartilaginous structure. This is actually which gives the shape of our nose. It has the two openings on it, which are called the nares. And in these openings, we can see the hair, which are called vibrissae, and which actually are against bigger foreign bodies, so they prevent foreign bodies getting into the nasal cavity. Our noses have some muscles, but these are quite rudimentary muscles. So in animals, they are much more pronounced. The animals can move these muscles much better. In human, these are rudimentary, and actually almost only in newborn babies, the movement of these muscles are or can be visible, and it could be a sign of so-called laboring breathing. It is a heavy breathing. Okay, so children who cannot tell you that they can't breathe, with them, what you can see is that their nose moves a little bit. The wings of the nose, which is this part, begins to move. Okay, and this could be the sign of a heavy breathing, of the so-called laboring breathing. Okay, this is a very important sign that you have to know about. In the middle of the nasal cavity, we have a septum. Okay, the septum is the structure which divides the nasal cavity into a right and the left part. The septum has a bony part and a cartilaginous part. Okay, the bony part consists of two bones, the perpendicular plate of the ethmoidal bone and the vomer below it. And in front of these bones, we have a cartilaginous septum as well. Okay, this bony nasal septum can be deviated. Maybe you've already heard about the nasal deviation or the septum deviation, which can be operated, and this is how it can be cured, so to say. The nasal cavity itself has two main parts. The outer part, which contain the hair, is called the nasal vestibule. Okay, the nasal vestibule has a different structure. It's histologically also different. It has a stratified squamous keratinizing epithelium, so just like our skin, it is actually the same. This is why it can contain hair as well, and glands, sebaceous gland or sweat glands, for example. And the bigger part of the nasal cavity behind the vestibule is called the nasal cavity proper. Okay, in this part of the nasal cavity, we already have a different kind of epithelium, which is a pseudostratified columnar epithelium with kinocilia and goblet cells. Okay, this epithelium is the so-called respiratory epithelium, which is characteristic in the whole respiratory system. Okay, so pseudostratified columnar epithelium with kinocilia. Behind the nasal cavity proper, we have the pharynx, and to be more precise, this would be the so-called nasopharynx. The opening between the nasopharynx and the nasal cavity proper is the so-called choana. Okay, this is the histological picture of a stratified squamous keratinized epithelium. Okay, the epithelium you already talked about in histology and in the histological lectures. So it is stratified, meaning that only the lowest layer of the cells are in contact with the basement membrane, and then the other layers are sitting on top of this basal layer. Okay. Squamous means that the uppermost layer consists of a squamous epithelium, and keratinized means that on the top of the epithelium, as the most superficial layer, we have a keratin layer, which is actually the dead epithelial cells. Okay, in this kind of epithelium, which is actually characteristic for our skin all over our body, we can see hair follicles with hair inside it. Okay, these are the hair follicles, and we can see different glands as well. Okay, these whitish structures, these would be the sebaceous glands, which open into the hair follicles and which produce a fatty secretion. And deeper down, with this magnification, it's not that very well visible, but deeper down we have also sweat glands. Okay, so this is the histology of the nasal vestibule. The nasal cavity proper, as mentioned, it has a pseudostratified epithelium. Okay, pseudostratified means that all of the cells of the epithelium are in contact with the basement membrane, but not every cell reaches the apical surface. Okay, so basically it means that there are shorter cells like these, and there are taller cells which reach the apical surface, which reach the lumen. Okay, these taller cells have kinocilia on their surface, and between these epithelial cells we have goblet cells as well, which belong to the glands. Okay, they produce mucus on top of the epithelium. Okay, so these goblet cells and the salivary glands, which are found below the epithelium, these will produce a mucus layer on top of the epithelium. And the kinocilia, as they are movable structures, they can move this fluid film on top of the epithelium. Okay, and this is the so-called mucociliary clearance or mucociliary transport. And this is important for the protection. In these mucus film, dust particles or any other foreign particles get stuck, and the movement of the kinocilia will move this layer outwards, towards the throat, towards the outer world. Okay, and this is why it's important in the protection of the respiratory system. On other hand, the function of the nasal mucosa, so the epithelium and the connective tissue below it, which is the mucosa, is to warm up and to humidify the inhaled air. Okay, so in pharmaceutical perspective, with the nasal cavity, and maybe the most important thing are the nasal sprays or nasal droplets. Okay, the nasal mucosa is very, very rich in vessels, and this is why there is a very, very quick resorption possible through the nasal mucosa. Okay, so the inflamed mucosa can be healed with a nasal spray, but this nasal spray you must know that these are very addictive drugs. Okay, so you should warn your clients later on, if you're working in a pharmacy, that there is a high risk of addiction if they use nasal spray. Okay, so they can maximum use these sprays 3 to 5 days long, and then they have to take a pause. Okay, so at least a week or more, have to stop with the nasal sprays. Okay, otherwise there is a big risk of addiction. Okay, and another thing which you've already know about is that the nasal cavity is a very strong connection with the skull and with the inside of the skull. Okay, the roof of the nasal cavity is actually a very thin plate which has openings on it. This is called the cribriform plate. Okay, and this is actually where our olfactory nerves are running through and passing through and going towards the brain. So this is the pathway of smelling as well. Okay, and through this pathway, actually drugs can be also taken. Okay, and they reach the brain very quickly and the whole central nervous system quickly. The scientists are trying to experiment with different drugs, for example, against Alzheimer's disease. I read about that can be resorbed through the nasal cavity, okay, through this pathway. And as it reaches the brain much quicker and a much bigger dose, it can act much better. Okay, so inside the nasal cavity, we have the nasal conchae or nasal turbinates. We have three such structures in both sides. Okay, there is a superior one, a middle one, and an inferior one. And at the back, as I already mentioned, we have the outlet of the nasal cavity towards the nasopharynx, and this is the so-called coana. In a frontal cut, which means that we cut the skull in the frontal plane, this is what we would see. Okay, we see the orbit. Okay, these are the orbits. And this is the nasal cavity in the middle. Okay, here you can see the nasal septum. And on the sides of the nasal septum, you can see the two nasal cavities. Okay, we can see the bony nasal turbinates, superior one, middle one, and inferior one. And below each nasal turbinate or nasal concha, we have a passage. Okay, and these are called meatus. Okay, and so we have the superior nasal meatus below the superior nasal concha, the middle nasal meatus below the middle nasal concha, and the inferior nasal meatus below the inferior nasal concha. And between the septum, the nasal septum, and these nasal turbinates, we have the common nasal meatus. Okay, these meatuses are important because different cavities of the skull will open here. Okay, these cavities are the paranasal sinuses. Okay, the paranasal sinuses are actually air-filled spaces inside the skull, inside different bones of the skull. Okay, the biggest one is the maxillary sinus, found in the maxilla, just next to the nasal cavity. The second biggest one is the frontal sinus, which is found in the frontal bone, just above the nasal cavity and the orbit. And then in the ethmoidal bone, we have the anterior, middle, and posterior ethmoidal air cells. These function as well as sinuses. And the last one found in the sphenoidal bone called the sphenoidal sinus. Okay, all of these sinuses, as mentioned, they are air-filled spaces inside these bones. And the function of these sinuses is actually to make these bones lighter. Okay, and with this, the whole skull will be a little bit lighter. This is one of the functions. The other function could be that these spaces can function as resonance rooms for the phonation, for speaking, for making voice. Okay, so just like with different instruments, you can imagine, for example, a guitar. The guitar has also a cavity which actually increases the sound, increases the noises. Okay, and this is how these paranasal sinuses can also function in the phonation. Okay, so they can increase the sounds a little bit. Okay, the paranasal sinuses are also lined with the nasal mucosa, so with this respiratory epithelium, which is this pseudostratified columnar epithelium with kinocilia. And here in this picture, you can see where these paranasal sinuses open. Okay, so all of them are in connection with the nasal cavity. The sphenoidal sinus opens up in the common nasal meatus, the superior one, the posterior ethmoidal air cells into the superior nasal meatus. The most of these paranasal sinuses open into the middle nasal meatus. Okay, and these are the frontal, the maxillary sinus, and the anterior and middle ethmoidal air cells. To the inferior nasal meatus, another structure will open, and this is called the nasolacrimal duct, which is a canal connecting the orbit with the nasal cavity, okay, through which the tear can reach the nose. Okay, so this is why our nose runs when we are crying, okay, because there is a connection between the orbit and the nasal cavity. But these paranasal sinuses can inflame quite easily, and most frequently we can experience the inflammation of the maxillary or the frontal sinus. Okay, in this case, actually the mucosa thickens, there will be a fluid accumulation, and we usually can experience pain as well, which will be worse as we bend forward. After the nasal cavity, the air gets into the pharynx. Okay, the pharynx is actually a muscular tube hanging from the base of the skull. And this muscular tube has connections toward the nasal cavity, toward the oral cavity, and at the lowest part toward the larynx. Okay, and the pharynx then will continue in the esophagus. Okay, but the air, as it gets into the nasal cavity, first it will reach the uppermost part of the pharynx, which is called the nasopharynx. Then it will reach the oropharynx, which communicates with our oral cavity, and the last portion will be the laryngopharynx, which communicates with the larynx. So this is the pathway of the air. So nasal cavity, nasopharynx, oropharynx, laryngopharynx, and then the air gets into the larynx. In the nasopharynx, so the uppermost part of the pharynx, which is found behind the nasal cavity, we have an opening, an important opening, and this is called the pharyngeal opening of the auditory tube, or eustachian tube. Okay, this is a canal which connects the middle ear, so the tympanic cavity, with the nasopharynx and with this actually with the outer word. And this is important to equalize the pressure between the tympanic cavity, the otherwise closed tympanic cavity, and the outer word. Okay, in the nasopharynx we can also find a tonsil, the pharyngeal tonsil, okay, which is active mostly in children, and it reaches the maximum size in childhood somewhere around year 5 or 6, and then it regresses. Okay, why is it important to know about? Because if the pharyngeal tonsil gets inflamed and it gets bigger, so it gets swollen, then it can block the airways. Okay, and on the second picture, you can see how the removing of the pharyngeal tonsil is done. So usually with an instrument, they go through the oral cavity and they scratch off the tissue of the tonsil. Okay, and it can be quite big, as you can see it here on the right picture. Okay, the second part of the pharynx is the oropharynx. Okay, this is behind the oral cavity, and here actually the pharynx communicates with the oral cavity. Okay, so the air from the nasopharynx gets into the oropharynx, and then it will go to the laryngopharynx, okay, which is the last part, the lowest part of the pharynx. Okay, and here we have the laryngeal inlet, which you can see on the picture. So let's see the histology of the pharynx. So as the pharynx is in communication with the nasal oral cavity and the larynx as well, it's not only responsible for breathing, for inhalation, expiration, but also for taking food. And this is why we have different epithelium on the surface of the different parts of the pharynx. Okay, so in the nasopharynx, where only air gets in, we have this pseudostratified columnar epithelium with kinocilius. So just like in the nasal cavity, as the continuation of the nasal cavity, in the nasopharynx, we also have this epithelium. Okay, below it, in the oropharynx, where not only the air, but also the food goes through, we already have a little bit thicker epithelium with better mechanical resistance, and this is stratified squamous non-keratinized epithelium. Okay, all over the pharynx, we have a typical wall structure, okay, with 3 main layers, where the first layer and the innermost layer is the mucous membrane called the tunica mucosa, which consists of an epithelium and the underlying connective tissue. After this, we have again a connective tissue layer called the submucosa, which consists of loose or a little bit denser connective tissue. And then we have a tunica muscularis, which is composed of skeletal muscle. Okay, after this, usually we again have a connective tissue layer called the adventitia. Okay, this is the mechanism of swelling and swallowing, sorry. Okay, so, and how then these pathways through the oral cavity and through the nasal cavity changes. So as we breathe in, as we inhale, the soft palate is hanging downwards, and the epiglottis, this cartilage which surrounds the inlet of the larynx, is straight up. Okay, so the air can pass through the nasal cavity, nasopharynx, oropharynx, laryngopharynx, and then gets into the larynx. As we swallow, as we take the food, then to prevent the food getting into the nasal cavity and into the nasal pharynx, the soft palate will be elevated, okay, and actually this closes the passage towards the nasopharynx. The epiglottis moves a little bit, and the inlet of the larynx will be a little bit smaller, and so the bolus, so the food, can get into the pharynx and into the esophagus. Now, how is the larynx built up? The larynx is mostly cartilaginous, so we have cartilages, and actually there is a bone as well, the hyoid bone. Okay, the main cartilages will be the thyroid cartilage. Okay, below that we have the cricoid cartilage, and at the back we have the arytenoid cartilage. Okay, these are the three main cartilages. There is one more called the epiglottis, and we can see more cartilaginous rings below the larynx, but they already belong to the trachea. Okay, between the cartilages, we have connective tissue membranes. Okay, this would be the thyrohyoid membrane or the cricothyroid membranes. Okay, the thyroid cartilage is the one which is palpable and also visible in man. This is actually which builds or makes the Adam's apple. Okay, and just below it, we can find the cricoid cartilage. Inside the larynx, if we make again a frontal cut, so in the frontal plane, if we do the cut, then we have the main parts of the larynx. We can see the main parts of the larynx. Just behind the epiglottis, after the inlet, we have the laryngeal vestibule. Okay, this is the first part. Then we have a little cavity on the sides, which are called the laryngeal ventricles. And then the lowest part is called the subglottic cavity. In the larynx, we can find the vocal folds, and next to it, the vocalis muscle. And in between the vocal folds, actually, we have the space through which the air can pass. Okay, and this is the glottis or rima glottidis. Okay, opening and closing the rima glottidis, we can make different sounds. We can make different noises. This is the so-called phonation. There is a clinical importance of these membranes or ligaments connecting the cartilages. We have the ligamentum conicum, the conical ligament, conoid ligament, which is found between the larynx, between the thyroid cartilage and the cricoid cartilage. And in case of a conicotomia or coniotomia, we have to cut it through. Okay, so there is a blockage. If the rima glottidis is blocked, okay, and we cannot breathe, then below the cricoid cartilage, somewhere here where actually this arrow ends, there would be this this ligament which we have to cut through, and this is how you can open up the airways, and then the breathing will continue. Okay, from an upper view, these are the vocal ligaments, and in between them the glottis. Okay, this would be the thyroid cartilage, the cricoid cartilage below, and on top of the cricoid we have the arytenoid. Okay, and as we move the vocal ligaments with the muscles around it, we can regulate actually the size of the glottis, and with this we can influence the sounds. Okay, when we swallow, so when we would like that the food gets into the pharynx and into the esophagus and not into the larynx, then the glottis is closed. Okay, as we speak, there is a vibration of the vocal folds and the vocal ligaments, and the rima glottidis is open, but not so widely open. And as we breathe, it opens up much better, and the heavier we breathe, the bigger this opening will be. And for finishing, I have a little animation, which, yeah, now it works. Okay, so this is actually the vocal folds and the rima glottidis from an upper view, from a superior view. Okay, breathing in, heavy breathing, it opens up. Okay, and actually as we speak, it vibrates like this. Okay, so it very, very slightly vibrates. The opening is much, much smaller than in case of breathing. And with these fine movements, we can regulate the tone of our voices. Thank you for your attention.